inviting me to this event to speak about health effects of extreme health, but I will try to bring in this extra layer to this very multidisciplinary topic, a very multidisciplinary meeting in how we deal with climate change, health effects, and heat as one of the central topics here. So I will talk a little bit as an epidemiologist that primarily works with environment and health and air pollution and health. And in our area, climate change has sneaked in kind of as very necessary co-exposure related to air pollution. It just shows how we're kind of deal with climate change and extremely fast changing environments. We all kind of need to work together to understand these complex exposures and their impact on our health. So I will, as an epidemiologist, start focusing a little bit on extreme heat exposure and build in what Freddie has said, how much are we exposed, who is exposed, what are projections for future. I'll focus quickly on health effects, and we'll hear much more at this exciting meeting for many small projects all around the world. We'll tell even more about this in detail. I'll look a little bit into literature on some physiological effects of heat, but also some epi-studies on how we quantify this big burden of disease, this mortality, these big numbers. And as Freddie mentioned, we're still not so good to quantify because there's still a lot of lack of data. Links between heat and air pollution, and then I'll bring a little bit why this is important and some of the newest knowledge from newest projects that looked at this interaction. And something that's close to my heart because I'm an epidemiologist, but also work with European Respiratory Society on bringing new evidence on environment and climate change to health professionals. I'll talk a little bit about that and why this is important to mitigate health effects of heat. And I'll end with some conclusion and call for action, as Freddie did. So the main topic here, of course, is that we have this extreme, unprecedented increase in hot weather due to unprecedented climate change that drives this global warming. And no matter how you look at it, whether it's annual averages in the last 50 years or these 5-year averages compared to pre-industrial era, we are seeing this sharp curve that just keeps going on, and new records are being broken every year. Global warming is not affecting us equally around the globe. Europe is actually the fastest warming continent, warming at nearly twice the average global rate. Even within Europe, we see differences in global warming. I think we've already seen in Freddie's graph, but in Europe, we see much more effects in Eastern and Southeastern Europe. And again, whether we measure in number of heat stress days or tropical nights and all these different measures that are important for health, we see sharp increases any way we look at. But again, still a lot of inequalities in exposure to heat across Europe as well as globally. Heat is going to continue to pose big challenge, and heat is going to increase. We don't know how much. These are some of those climate change scenarios. The socioeconomic pathways, most of you, I assume you have seen this. I'm not going to go into too much detail, but we know that even in the best scenario, which is the blue line, we will be in a world 1.4 degrees warmer. So we will live in a much hotter world, but as it looks right now, we're likely maybe facing the much warmer world. This is climate scenarios according to how much socioeconomic and policy decisions are being made. So we're really entering a kind of unknown territory, really, in how much hotter world we're going to live in. But definitely, heat exposure is going to increase one way or another. This is also for me. For conclusion for the talk, we still have effect on which scenarios will end, and I think this is important call for mitigation action. This is another nice illustration of how much different world we're going to live in under different climate scenarios. For those of us born in the last century and the new generation, this is quite a different world, quite different. Not just heat, but many other correlated exposures I'll talk about later. And we need to adapt and learn about this, and we really need much more knowledge and more research investments into this that, again, from Freddie's talk, we don't have currently. So direct health effects of heat are ranging from mild discomfort. A lot of us connect heat to being on a beach and a good thing, and maybe we have mild discomforts, but heat can really cause life-threatening conditions under very extreme conditions, as we see increasing number of heat waves and increasing record-breaking temperatures, especially in populations that are not used to it. This can lead to a number of health effects. Body normally cools itself by sweating and increasing blood flow to the skin. This normal thermoregulation. When this becomes extended exposure to heat and very extreme heat temperatures, that can lead to dehydration. They can lead to heat exhaustion and heat stroke and cardiovascular effects. They can lead to fatal consequences, either death or serious consequences such as hospitalization and so on. These are some of the most well-known heat or most studied heat health effects. We also know that heat affects difficulty breathing, especially in chronic lung patients, and more we are aware of heat impacts on brain, on mental health. I think we all feel when it's very hot that we feel a little bit maybe more harder to focus to work if we're not in cool areas. Can lead to confusion, difficulties concentrating, especially in mixed with sleep disruptions and poor sleep during heat periods at night. This can lead to irritability, anxiety, increased symptoms of depression, especially those with pre-existing mental health, and even risk of suicides and serious consequences. I would like to refer you to this nice review by Chrissy Abbey, one of the leading global climate change experts. If you want to dig into more of these physiological mechanisms, a review of studies that looked into different ways how heat affects physiological processes that can lead to these fatal processes, from dehydration to impact on the kidneys, which is also very important, both acute effect but also accumulated long-term effect of heat that we especially see in outdoor workers. Kidney failure is one of the very important consequences, to effect on the heart and the fatal consequences and the critical organ failure. So I'm not going to go in detail. But some of the key messages from this work is, of course, restating that heat does lead to increasing mortality and serious morbidity outcomes, pregnancy outcomes, and mental health, but also it reduces physical work capacity, cognitive performance, affect productivity, and has this important consequences of occupational health problems. And one of the also key points here that the exposure to heat is really enormous. Half of the global population is exposed to heat waves at some level or the others, or high heat, extreme heat. And 1 billion workers are globally exposed to high heat episodes, and 1/3 of them experiences health consequences. So I think these are really some striking numbers of the exposure to heat and how large scope of this exposure as we think of heat as a health risk factor. This is just another way to look at the number of different organs that are affected by heat, a nice schematic, and also points out to this either side effects of heat, and also heat rash, sunburn, profuse heat, sweating, skin cancer risk, and so on, just to mention some additional points. Lung health, of course, something when we work with European Respiratory Society, is something we feel very important, because lung patients usually react to air pollution, but also to heat very immediately, and have difficulties breathing if their lungs are already kind of under stress from chronic lung disease and so on. Hot air, especially hot and humid air, is more difficult to breathe and can trigger symptoms for asthma, COPD, and lead to death from these diseases as well. So heat and health doesn't affect everybody equally, and there needs to be focus on susceptible groups. And again, there will be a lot of great talks about, especially some of the most susceptible group is pregnant women and birth outcomes. I'm not going to talk more about that, but I look forward to talks later in the seminar. Infants and young children play outside more. They're under development. The thermoregulation is not fully developed. They have higher surface area to body mass ratio. They heat up faster, so kids are especially vulnerable. Older adults who also have reduced thermoregulation possibilities, reduced sweating and heat perception. People with chronic diseases are especially vulnerable. Outdoor workers, we already heard about that, and had a very nice film showing last night about very severe impacts on outdoor workers, athletes, and outdoor people in sports outdoor. This is also a topic brought up in Chrissy Abbey's nice review, and how do you plan sporting events, Olympics, and so on, in increasing heat form world. Also interesting aspects are people taking medications for very serious conditions and how that impacts their way to deal with heat. It's an increasing area of interest, and very important to know how to advise patients in heat, in hot heat, during heat waves and heat, and people without access to cool environments. So this is really the inequalities issue and socioeconomic inequalities. People in lower socioeconomic classes, that even in high-income countries that don't have access to cooling, to air conditioning. A lot of low and middle-income countries also have poor access to cool environment, and some of the most marginalized groups. And I think we've seen also some research here in homeless people, migrants, refugees, and so on. So some of the epidemiological work on the impact of heat waves started in heat wave of 2003. I think that was kind of the, I don't know how many of you remember that one, but it was maybe the first turning point in the development of these public health policies and acknowledgement of the heat wave as a serious health problem. The first study that came out was just focused on France. That was where the heat wave happened here. This was from 1st to about 13th of August in 2003. This anomaly of temperatures to 36, 37 degrees, where normally would be around 25, was really something that was felt and covered by media. And the first study estimated about 15,000 deaths only in France due to this heat wave. After that, a number of studies have tried to estimate what was the impact of this heat wave in the entire Europe. It does, of course, only affect France. Number of different estimates came out of these studies, and the European Commission has given money to this heat wave project to try to really collect data in a systematic way and do the better estimate of the mortality and impact of this heat wave. And this also landmark study showed that around 70,000 deaths in Europe are attributable to that heat wave, and most of them came in Italy and France. But they also, and the way they compared this, they compared it to reference period of 5 years before that event. And this, of course, illustrates the great impact on this and compares it to some control countries where we didn't have impact of this heat wave, as Denmark and some other countries. But they also acknowledge, again, the lack of data. The Balkan region and some of the countries that were affected of heat wave did not have data at this time to estimate health effects. And this illustrates again that the need for better data. So this is still a likely underestimate of the full impact. So this was isolated events, and after that, we've seen more and more heat waves coming out, especially in more recent years. And the ICE Global group from Barcelona has, in the last 3 years, come out with these important papers estimating impacts of heat waves from 2022, then there was one in 2023, then there came 24 that was worse than 23, and now we see that heat waves are here to stay, and they're just kind of gaining in length and strength, and breaking new records every year. So this group has provided kind of a transparent, consistent way to estimate these numbers and show how many deaths are attributable now in heat waves. This graph up here shows that we know this is a well-established association between temperature and heat. We see more deaths in the cold and very hot temperatures, and optimal temperatures is somewhere around 20 degrees Celsius. And then they showed in this latest paper the anomalies in heat in these three graphs up there for 22, 23, and 24, and they compared with recalculating the numbers backwards to show that there were different heat waves affecting different parts of Europe, but still the most impacts are in southern and southeastern Europe. And now this latest paper showed again that early numbers were underestimated. So as we're getting better data, we're realizing that heat effects are larger than we previously thought, and we are getting better data at estimating these effects. This study also shows again that Southeastern Europe has been most affected, and this also coincides with some of the lower socioeconomic areas in Southeastern Europe and poses additional problems for adaptation and dealing with heat with access to adaptation measures. Another study by Anna Vicedo, also one of our colleagues working with this, looked at the burden of heat-related mortality, how much of this is attributable to climate change. And this is a very nice global study, estimated about 37% of heat-related mortality is directly attributed to climate change. So, and provides these numbers around many cities around the globe. This is very nice global data set on mortality and heat that provided also a lot of nice research on health effects on heat on overall mortality. Another important question with global warming is that shifting this curve on the temperature impact on mortality may be a good thing, that if you reduce cold-related deaths, maybe net effect won't be that bad, especially here in Denmark, where we still have more deaths due to cold than heat. So this is also another important study over with data over 800 cities that looked at that specific question under different climate change scenarios. And it found consistently that, especially with no adaptation to heat, the increase in heat-related deaths will exceed any decrease in cold-related deaths. So net effect is increase in heat-related deaths, and there's no benefits. But again, recognizing that there's a difference in some Nordic countries, including Denmark, will have maybe net decrease, while Southeastern Europe will have most dramatic increases in heat. There are some very also dramatic estimates, about 2 million climate-related deaths by the end of this century, and so on. Again, this depends on what climate scenarios you look at, but again, very great projections on the impact of heat wave on health. Another very important project that looked at impact of heat on health is funded by European Horizon Project, is the Exhaustion Project. It also made similar estimates and projections of heat mortality and came up with a similar number of about 2 million deaths for the rest of the century, but just pointed out that there will be about 20-time increase in number of people dying from heat by the end of the century compared to today. They had some kind of reference of 3,000 deaths, but now we see some of the latest calculations for 23 tells us 60,000 deaths. So no matter how you look at it, these numbers are really large. And this project also concludes that heat deaths will outweigh reduction in cold-related deaths. Besides these big numbers on overall mortality, few studies have also had data on cause-specific mortalities. It's also important, what do people die from heat? This, again, important study with data from more than 500 cities in 33 countries that you can see on this map, looked at cause-specific mortality related to heat and has found out, that actually respiratory patients are most susceptible to heat, and there's more respiratory related deaths due to heat, while cardiovascular deaths are the main cause to cold-related deaths. So these are also quite important studies, and we need more of them for adaptation measures and to know who is susceptible, which patients and which causes of deaths, and which diseases are most impacted due to heat and change in heat distribution. We also have few studies, but not many, that have data on hospitalizations, on mortality, but some measures of incidence or exacerbation of diseases. And this is a big American study with Medicare data. This is the health insurance data that looked at emergency room hospitalizations across US and found, again, excess respiratory Medicare hospitalization in this study specifically across US, and that was also a very important study to show how heat increases need for healthcare preparedness to deal with heat waves in terms of hospitalizations. And we need more of these numbers to know exactly how to prepare our healthcare systems. So next I'll touch a little bit about this air pollution and air heat interaction, why air pollution and climate change are more and more considered together, both for action and looking into health effects. And this is mainly because we have shared sources, overlapping health effects, and this is really an opportunity for common solutions. So main sources of air pollution are also major sources of greenhouse gases. When we talk about air pollution, it's really mainly burning of fossil fuel and biomass from residential heating, coal and wood burning from transport, from energy production, industrial activities. These are main drivers of air pollution that is harmful to our health and get greenhouse gases. Of course, other sources of air pollution from agriculture, waste burning, residual crop burning are also relevant for climate change. Cities are the hotspots where people live, where we have this urban heat island effects. We also heard about it in a movie last night, where temperatures could be much higher due to lack of green spaces and urban land use, making cities much hotter than surrounding green areas. But cities are also hotspots of air pollution exposure. This is where people live, travel, and where we have highest levels of air pollution. So this is really the places where people are exposed to these levels. Just briefly on air pollution. Air pollution is the #1 environmental health risk factor for health. We are all exposed to levels of air pollution that are harmful to our health. Air pollution levels differ around the world, but you can quickly see here with yellow being the highest levels that they overlap largely with the hottest areas in the world. So this already gives you a picture of this both problems being some of the highest in Southeastern Asia, Eastern Europe, Northern Africa, and here around equator in Latin America. These are also the area that will be affected by heat. 8 million people die from air pollution every year, also very dramatic numbers. Most of them, again, the numbers overlap with areas that will have extreme heat challenges. And a lot of many of the diseases that are related to heat are also related to air pollution effects, which are ischemic heart disease, respiratory diseases, mental health. Dementia has been just recently added to air pollution list of diseases, and so on. This makes air pollution #2 health risk factor overall compared to all other risk factors, because everybody's exposed and because there are so many diseases linked to air pollution. In Europe, we also see large inequalities in air pollution, with Eastern and Southeastern Europe most affected by air pollution. This is also related to energy poverty, and a lot of sources from wood burning, coal burning, dirty industries, and so on. And these are, as we've seen previously, area affected mostly with climate change and global warming. Again, a lot of same organ systems that affect heat are already compromised by exposure to air pollution, especially there where air pollution is the highest, from cardiorespiratory, but also now chronic kidney disease has also been linked to air pollution in some of the newest studies, mental health, and so on. So I want to just bring briefly, before I conclude, these results from the exhaustion project that I mentioned earlier. This is the first project that looked at interaction between air pollution and heat, specifically addressing this area, that air pollution and addressing, I think this is a nice schematic, that air pollution is going to be worsened by climate change, because climate change and global warming is increasing ozone in the cities. Ozone is an important respiratory irritant and increases also number of the people dying from air pollution, and we'll see more of ozone with increasing sunlight and heat in the cities. Climate change is also making a big increase in wildfires and sandstorms, and I'll talk about that later. That's also exacerbating climate change because it's bringing more emissions into the air. And it's a vicious circle, so that we breed climate change as we are exposed to heat. I think it's a very nice way to think about that. A very important result that came out of this study is that this study looked at a number of cities across Europe, and Francesca, that's going to talk later, has been part of this study. So from Rome to Oslo, from south to north, in all cities pretty much in this study, we've seen that synergistic effect of air pollution and heat. We know that more people die on the days that are very hot. More people die also on days with high air pollution. But when you have the mix of both, you have hot days and high air pollution, there's even more people dying. This is really a very dangerous mix of particles in the air, hot air, than what can be attributed to each of these exposures alone. So this really illustrates both for cardiovascular and respiratory deaths that this important synergy calls for even more action for air pollution, because we're going to see increase in heat, that's without a doubt, but cleaning up the air can make us more resilient to these extreme effects of heat. Exposure to wildfires is something that is really now emerging as one of the main challenges in air pollution all around the globe, also in Europe. Also, we've seen some reductions in air pollution from other sources. Wildfires are really going to be increased due to global warming, but most of the wildfires co-occur with heat waves. So populations that are exposed to heat waves, usually there are a couple of examples from these wildfires in Canada, in California, that you have populations maybe exposed to a heat wave for a week, very high temperatures, or 2 weeks. That goes along with drought, increased risk of wildfires, then you get these huge amounts of particles to local communities that travel abroad. So this complex exposures to heat and then very toxic particles and how they interact and how they disturb also healthcare systems, it's really something we don't really understand yet in a full impact, and we cannot just study alone one exposure separated from another. Another big emerging issue with climate change and air pollution is sand and dust storms. If you look at this map, where we have sand and dust storms, and again, due to climate change and increase in extreme weather, we're seeing more of these sandstorms and sand that travels further away and affecting areas beyond just these hotspots. We see again that they overlap with areas where it's really hot. So you see these sandstorms in the cities, whether it's around Sahara region, North Africa, in Southeast Asia, Australia. There's the cities from all around the world. These are larger particles with different health effects, but of course they occur most often in very hot areas. And then again, how you deal with this and what are the interactions and the health and what kind of warning system do you pose. And another, this just made me think, Southeastern Europe, from Serbia, where I come from, actually, this happened a few years ago. It's not just wildfires burning, but waste management or waste mismanagement is also a big problem in a lot of parts of the world where you have unmanaged waste dumps. Because of extreme heat and drought, a lot of these waste dumps burn. So you can imagine what kind of toxic materials burn. This is a map of Serbia. Well, this was a major fire in Belgrade, the capital city, where over 5 days, heat wave, August, and the garbage burning with plastic and metals and whatnot. Extremely dangerous situation, and denial from the local authorities. There were people swimming, dealing with heat wave and exposed to these toxic chemicals. And a lot of these dumps are around big cities, and there's also a problem around the world. So it's not just wildfires, bushes burning, but a lot of more toxic materials. And we see more and more of these with heat waves and the danger of these things burning. So how do we deal with this? Just to wrap up, in European Respiratory Society, where I mentioned that we do a lot of work on bringing awareness of climate change impacts and air pollution and environmental change to medical professionals and to patients, we consider extremely important, because this is a health issue, so we really need to educate and inform and equip our health professionals to deal with these issues and get this knowledge that is fast emerging. Most of the doctors working today did not have proper education of these issues in their medical curriculums, because things are changing so fast and new evidence is coming so fast. Just a few years ago, we published this climate change and respiratory health statement, position statement, which kind of gives an overview of what are the main impacts of health effects of climate change and heat. And this is an example in our publication where we made one publication as a statement for policy and call for action, and another statement more for clinicians, kind of clinical guidelines to explain to clinicians how heat and climate change will affect respiratory health. And again, a lot of these from heat humidity, but also many other exposures that, again, I focus on air pollution, but also change in pollen allergens, in new infectious diseases, and many other and worse air quality will affect respiratory patients and other chronic disease patients in a manner and complex way that we still don't know enough about. So this is also one way that we want to engage more with health communities and educate them on these issues, because they could be important in informing their patients and taking up a clinic to mitigate some of the adverse effects. So to conclude, we have enough evidence, although we don't have that much evidence, and there's not much money in not very good data on heat waves, and most of the evidence comes from high-income countries, from Western Europe, US, and so on. We do have enough evidence to know that extreme heat is a major and rapidly increasing health concern as climate change accelerates an unprecedented change. We know that interactions with other 8 major environmental and climate-related hazards, from air pollution to high humidity, drought, heat can affect us differently if it's very humid or dry, wildfires, dust storms, but also pollen and new infectious agents that I didn't have time to get into. All of these complex interactions raise additional health concerns and demand more research. And specifically for most vulnerable, and here we need more research, we need more data, especially for low middle income countries in some areas that are most affected. We lack acutely good data to provide research, because this is extremely important to educate local communities and generate political action to do something about it. Still, with the call for more research and funding for that, we have to be insistent that we know more than enough to call for action. And this is always kind of conflicting when you talk to policymakers. Sometimes call for research is misunderstood as, oh, we don't know enough, we have to wait with action. That has been used maybe too much in the last 30 years, and as long as we had COP. The health impacts of heat and climate change came on COP agenda just a few years ago, and that's way too late. So the clear message here is that current evidence is clear and enough to call for urgent climate action. And here we both need mitigation and adaptation. We can still mitigate climate change. We can still work towards a more favorable scenario that will give us less warm environments in the future. And here, very ambitious measures to reduce greenhouse gases are necessary. We call for fossil fuel phase out and so on. Because this can slow climate change and lead to more favorable warming trajectories and smaller consequences for our health. At the same time, we need to adapt. Heat waves and heat exposure is already changing our environment, and we need to develop better heat action plans, early warning systems. We need to work with urban planners to cool our cities and to provide proper education to protect everybody, but especially most vulnerable groups. And all of these can substantially reduce health-related health impact, and we know how to do it. Clean air policies provide multiple benefits, and we need to work together with climate and air pollution communities, both for research, but also in pushing for policy making that we see clear multiple benefits with cleaner air, reduced direct health impacts of air pollution, but indirect health impacts by reducing greenhouse gases emissions. And we make everybody more resilient to increasing heat by having cleaner air to breathe. Public communication and ongoing education for medical professional patients is extremely important. Medical professional patients are the strongest voices in fight for more action on climate change, but also they need knowledge to protect themselves and those most vulnerable around themselves. And we need more to engage with health professional and patient communities. And with that, I will end. I didn't go too much over time, but too late. Time for your question?
Yes. You on the side. Can you hear me now? Yes. Thank you so much, and thank you for highlighting the interaction between different hazards and not just heat as a single univariate outcome exposure. Sorry. We have a few minutes for questions, and then we'll keep the conversations going in the break. So any burning questions, please shout them to me. I will repeat them over the microphone so that the people online can also hear them. So from the audience, anyone?
Thank you very much for this very nice overview. I was just a bit curious, and perhaps it's not very ethical correct to do that, but I mean, mitigation is what we can do on the long term, but it will not help pregnant women, small babies, elderly people today and tomorrow and so on. Could you make an action plan, for example, targeting only pregnant women and babies and young children? Would that be, let's say you have a limited amount of resources, or I mean, it's also connected, but is that at all possible to do interventions like that?
Well, I think we do all of these interventions at the same time, right? We need heat health plans for the most vulnerable groups, and then we need community plans, and we need political action in the long term to provide mitigation and adaptation. So I don't see that as unethical and so on. So you're asking how mitigation can help pregnant women today. Well, I would argue, we just had a clean air forum in Brussels last week and pointed out that there are some short-lived climate forcers like black carbon, which it captures. This is air pollutant and climate forcers, and reducing the black carbon would actually provide immediate health benefits. You see, actually, even air pollution as heat, from day to day reduction will provide better health tomorrow for a lot of people breathing cleaner air, and quite fast climate benefits, because black carbon is short-lived. This is only a couple of days to weeks, while CO2, which we mostly focus on, is a long-lived climate forcer, and you will see benefits until long. So there are low-hanging fruits with more immediate benefits. So I think that's been distraction, that these are long-term benefits. Too late, let's just focus on adaptation. The train is strong. So.
Thank you so much. We have time for one last question over here.
Thank you. That was really wonderful. My question is, given the slow progress in implementing key climate recommendations like the Paris Agreement, the nationally determined contributions, the COP, the health-related agenda, and considering the influence of the politicians, the low funding for the health systems, what strategies can we adopt to strengthen momentum and win this battle of climate change? Yes.
It's $1 million question. Well, yeah, it could be very discerning that we had this knowledge for many years, and there's nothing happening. There's not enough happening, clearly. I think we're facing one of the worst climate change scenarios if the rate of change is happening now. We're also facing a lot of disinformation and discreditation of science right now, which is not helping us, and these cuts in funding, and even from US and on Europe, we see even less funding, and the regulation of European climate and environmental laws is also not what's on the agenda in EU, so it's really discerning. I hope that we still can win this by really just providing information, doing what we're doing, providing with all the resources we have, and joining our communities who are working on climate or air pollution, on biodiversity, and going maybe bottom up through informing communities, engaging in local studies and citizen science, and especially I think there's the opportunity with engaging more with patient communities that experience this, and clinical communities, and engaging doctors in this health lobby, raising health argument as the most important argument with climate change, that we can have more success in coming years. But this is very great discussion for the rest of the.
Yes, thank you so much.